Hello everyone, we are Team BioWizards from Jai Hind College, Mumbai. Our team members include I'm Kaushani Homroy.
Myself, Risha Mazumdar.
Hi, I'm Kanak Joshi.
The United Nations Expert Group at a meeting held in Nairobi in 2002 operationally defined a slum as a human settlement that has the following characteristics: inadequate access to safe water, inadequate access to sanitation and other infrastructure, poor structural quality of housing, overcrowding, and insecure residential status. Currently, these characteristics describe communities that comprise 48% of the combined urban population in all developing countries and 78% of the urban population in least developed countries. Thus, in many developing countries, life in slum settlements has already become the norm of urban human existence. In India, during the monsoon season, there is a notable rise in the occurrence of diarrheal diseases, primarily attributed to the contamination of water sources and unsanitary conditions. These seasonal diarrheal pathogens are responsible for causing a range of gastrointestinal infections, some of which can be life-threatening. In the biological landscape of disease during the monsoon season in India, the surge in diarrheal cases is intricately tied to the compromised state of water sources and unsanitary conditions. This surge is not just a statistical spike, it's a breeding ground for gastrointestinal infections, some with potentially fatal consequences. In the realm of clinical manifestations, there are three distinct phases of this watery foe. Acute watery diarrhea lasts several hours or days and includes cholera. Acute bloody diarrhea, also called dysentery, and persistent diarrhea, which lasts for about 14 days or longer. Let's delve into the specific biology and classification of these pathogens. Identifying seasonal diarrheal pathogens. The first one is Vibrio. Cholera is a notable diarrheal disease caused by Vibrio cholerae and a waterborne bacteria. It thrives in stagnant water and can contaminate water supplies, leading to severe watery diarrhea and dehydration due to production of cholera toxin. The second one is Shigella bacteria. Shigella species are responsible for Shigellus, a diarrheal disease prevalent during the monsoon. These bacteria can invade the intestinal lining, causing inflammation, abdominal pain, and bloody diarrhea. Let's look into the classification of seasonal diarrheal pathogens. The first class of pathogen is bacteria. The symptoms caused by Vibrio is cholera, which produces cholera toxins leading to watery diarrhea and dehydration. Common drugs. Antibiotics are often used for Vibrio bacteria. Vaccination. Cholera vaccines are used. For Shigella bacteria, it invades intestinal lining, causing inflammation and bloody diarrhea. Common drugs are antibiotics, and no specific vaccines are known for Shigella bacteria.
Now, let's take a look at the actions which took place at the evacuation center. The team visited each and every house for doing the line listing. The line listing was done using a pre-tested schedule containing information of demography, socioeconomic status, and environment. Physical examination was carried out with proper history taking of all the probable cases. Stool samples were collected from all the cases of diarrhea, and the ORS packets were distributed along with the demonstration on how to use them. Treatment was started using antibiotics, and a few of the patients were also referred to district hospitals and medical colleges. By focusing on these demographic groups and collecting specific data tailored to their needs, we aim to provide targeted care, prevent further infections, and support the well-being of the entire community during this outbreak.
Now, let's look into the requirements for Shigella and Vibrio cholerae, that is, cholera infection. For the isolation required group, in slum settlements, medical teams for symptom assessment and sample collection like stool and blood, antibiotics if applicable, oral rehydration solutions, hygiene kits, and isolation tents are required. In isolation center, isolation units with healthcare staff, medical supplies, IV fluids, antibiotics, regular monitoring and sanitation facilities. For the medications and vaccines group, in slum settlements, medical teams for clinical assessment, provision of medications like antibiotics and rehydration solutions. In isolation center, if the conditions are not severe, oral medications, monitoring and rehydration therapy is required. At risk of contamination group, in slum settlement, health education sessions, provision of hygiene kits that include soap and sanitizer, regular monitoring for symptoms is required. In isolation center, if symptomatic, similar to medications and vaccines category is required. The team will be having WHO prepared emergency kit, which includes Interagency Emergency Health Kit 2017, which is USD $0.05 per person per month, cholera kits, trauma and emergency surgery kits, 50 patients per kit, and sample collection kit. These kits will play an important role in collection, identification, classification, and management of the scenario and issue in hand. In the endeavor to enhance the healthcare infrastructure, resource funding, and to support the slum settlement grappling with this disease outbreak, the NGO seeks to forge strategic collaborations with government bodies and to leverage the existing healthcare schemes. Now let's talk about these healthcare schemes in detail. First is the Special Nutrition Program. The target group for the Special Nutrition Program includes children below the age of 6 and expectant and nursing mothers. Now the main activity under this program is to provide supplementary feeding to its beneficiaries. Every child must receive 300 calories and 15 grams of protein, while expectant mothers and nursing mothers must receive 500 calories and 20 to 25 grams of protein. Moving on to the next scheme, we have Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. This was introduced with the aim to reduce the out-of-pocket expense. It is a publicly financed health insurance scheme to cover the socio-economically deprived rural population and the selected occupation category of urban population. It aims to cover nearly 40% of the country's population, that is 100 million households and 500 million people across the country. The scheme aims to provide health coverage of Rs 5 lakh through impaneled hospitals. Now talking about the next scheme, we have Swachh Bharat Mission. To accelerate the efforts to achieve universal sanitation, the Prime Minister of India launched Swachh Bharat Mission on 2nd October 2014. Under the mission, all villages, Gram Panchayats, districts, states and union territories of India declared themselves open defecation free. Now, this was done by constructing over 100 million toilets across the country. To ensure that the open defecation free status is maintained, the solid and liquid waste management facilities were made accessible. Moving on to the next scheme, we have National Rural Health Mission. The National Rural Health Mission seeks to provide quality health care to the rural population and to the vulnerable groups of the urban population. Now, the thrust of the mission is to establish a fully functional, decentralized and community-owned health delivery system. Now, this health delivery system would enhance the determinants of health, that is, water, sanitation, education, and social and economic equality. It contains two major sub-schemes: the village health sanitation and the healthcare service delivery. Now, these collaborative efforts will play a pivotal role in the NGO by helping in the implementation of this comprehensive healthcare plan for the slum settlement. This would be done by ensuring availability of medicine resources, improved sanitation, and healthcare access for the vulnerable population.
Now, let's take a look at a long-term public health strategy which revolves around sanitation and hygiene practices. Number 1. Access to clean water. To secure a reliable supply of clean water, we will initiate the installations of borewell, providing a protected source of groundwater. Furthermore, we'll establish water treatment facilities, where water from these borewells will undergo thorough treatment processes, including chlorination, filtration, for eliminating contaminants. Second, contamination monitoring. Monitoring for potential contamination of groundwater sources is very vital and crucial. We will vigilantly track factors like landfills, heavy metals, pesticides, insecticides, industrial waste, germs, and insect intrusions. Third, water quality testing. To guarantee ongoing water quality, regular water testing will be carried out. This includes engaging the community in actively monitoring the safety of water sources, and the community members will also be trained to recognize contamination indicators and report issues very promptly. Fourth, improving sanitation and hygiene. To promote proper sanitation and hygiene practices, we will distribute hygiene kits to residents. These kits will contain essential items such as soaps, hand sanitizers, disinfectants, and menstrual hygiene products. Simultaneously, we'll tackle the issue of open defecation using an scheme with Swachh Bharat Abhiyan. Fifth, composting and agricultural practices. We will introduce composting facilities such as biocompost and vermicompost. This will effectively manage waste. Now, key strategies will be two. Number one, vaccination programs and immunization. In the long term, we will implement vaccination programs in collaboration with local healthcare providers and informal healthcare providers, which is IHPs. These efforts will be complemented by awareness campaigns such as Raksha Immunization Mission, the RIM mission, to emphasize the importance of immunization. The RIM card is shown here. Next, Bhojan Immuno Mission, BIM. To bolster overall health, we will introduce Bhojan Immuno Mission, BIM, aimed at spreading awareness about fermented products, probiotic products, and prebiotic products. These dietary choices can improve gut microflora and enhance immunity. Now, in our plan, there might be several challenges which we need to tackle smartly, such as resource constraint, logistical challenges like weather impact, transportation, infrastructure damage, data collection and accuracy, as well as stigmatization. The team will engage in providing the mentioned actions and overcome challenges with utmost profession and care. To control the current outbreak of diarrhea, we will ensure and enforce social distancing measures and ensure the availability of oral rehydration solutions. Now, sewage and wastewater treatment will be a long-term priority to prevent potential pathogen development and endemics. This includes establishing a comprehensive and structured system for waste collection and sewage management. Involving IHPs is a very crucial and vital role in both immediate and long-term response. Collaborating with IHPs will provide clear guidelines and training to align their services with public health recommendations, ensuring their vital role in responding to the current scenario and crisis and future health challenges. This comprehensive approach engages the community like local authorities and continuous education to promote better health practices and improve overall well-being. Thank you so much.